Hi, Facebook. It's Jules with Radio Now 100.9, and we are doing another coping with quarantine discussion. I'm talking with my good friend, Dr. Kelsea Visalli. Today, we're going to be covering loss. Hi, Kelsey.
Hi, Julie.
How you doing?
Hanging in there up here in Connecticut. It's kind of chilly.
Yeah, how's the weather today?
I feel like every time we have these meetings, it's gloomy and raining. So
it was gloomy and raining here earlier today. Thank goodness. We're going to see some sunshine this afternoon because that always makes me feel good.
Same.
But let's get right into it. We're talking about coping with quarantine, specifically loss. COVID-19 definitely affected everyone I know in some way or another. And it's really hard to deal with. Some people might have lost loved ones. Some people might have lost jobs. Other people just might have lost their social life. How do we cope with all of this?
Yeah, for sure. And I was thinking about just the piece where we're not only grieving and losing in a different way, but now with the social distance piece, we're supporting each other so much differently over technology too. So one of the things I wanted to normalize is that the grief loss process can look very similar regardless of the type of loss. So there's social loss, there's job loss, there's losing somebody that in your family that you love, but we all tend to follow a similar kind of pattern of reactions. The intensity just might differ based on what the loss was.
So there are different stages and different types of loss, what you're saying?
Yes, it is what I'm saying. And if you'd like me to expand on the types of kind of common reactions, many people have heard of like the 5 stages of grief.
Yes.
They might not know exactly what that looks like though. So the common stages generally starts with denial, which can look like avoiding, ignoring, or maybe just being in complete shock mode. So somebody might not even be acting like they're experiencing grief or loss. But next can quickly come the anger stage. So it can range from just being kind of grumpy and irritable to being really hostile and snappy. And that's because anxiety and anger can kind of manifest together. So it might come across as irritable when really someone's just feeling really like anxious and nervous about the future. And then go ahead.
Is there a healthy way to grieve?
I think some people think it's supposed to look like a certain way, right? Mm-hmm. And so one of the things I always like to let my clients know is that everyone's grief will look super different. So we never want to judge or tell someone how to grieve. So a few kind of common grief reactions, there's delayed grief, which means that someone doesn't start grieving for a few months or maybe even a year later, and then it hits them. Have you heard of instrumental grief?
No.
Yeah, it's basically like someone's acting very busy and they have all these things to do, like they're taking care of the family, they're taking care of arrangements, they're just dealing with everything by staying busy. Usually the grief hits them a little bit later, but just because someone's looking busy and okay doesn't mean they're not feeling it internally, if that makes sense. And then there's a complicated grief. That means that we're struggling longer than maybe a year or something like that.
Okay, so we often hear the phrase that time heals everything. So you're saying it's completely normal that there's not a set limit on grief. It's completely normal to deal with grief whenever it happens.
Yes. And I think when we're starting to notice that it's impairing our functioning for a long time and we're kind of feeling like we're in distress all the time, all day, every day, that's when we might want to seek help or assistance in processing our loss.
So how can we help our friends and our family cope with loss?
Yes, that is such a great question because I think a lot of people, and for some reason this culture we live in is very uncomfortable with grief, loss, and pain. So the first thing I wanted to kind of really highlight is that we just need to give people space to feel their pain, which can be really uncomfortable and difficult, right? So, right? Because it's like, what do I say? I want to say the perfect thing, but it's really not about saying the perfect thing.
And sometimes I get uncomfortable because it's like, oh, I don't want to say the same thing that they've heard from everyone else and like seem ingenuine about it.
Exactly. Exactly. And most of the time people aren't looking for advice when they're grieving. They're looking for someone to sit with them in silence or sit with them in pain. And during social distancing, that might look like a FaceTime call that says, "Hey, I know that you just lost your job or you just lost a person or a friend. And I just want you to know that I'm here to sit with you on FaceTime and watch a show with you, or sit with you while you feel sad and you don't have to say anything." Just knowing they're there can make all the difference.
I like that. I mean, I never really thought about just watching a show via FaceTime with somebody could really help them get through with whatever they're dealing with.
Yeah, and not feel so alone.
So loss can also lead to depression. What are some signs we need to watch out for?
Yeah. So I really think distinguishing between grief and depression is super important, because I think people jump to, oh, they seem really sad. What if they're depressed? But there's actually a pretty clear distinction between the two. So with depression, our focus tends to be on ourself, this negative appraisal of ourself, low self-esteem, and even thoughts of, I don't want to be around anymore, which is very self-focused. Whereas grief reactions tend to be sadness around the specific loss that we had, whether it's a person, a job, a relationship, etc. And those feelings tend to come in waves. So it's not all day, everyday misery. It's like sometimes we feel okay, and then we remember the loss, and then we have a wave of sadness. And we might have physical sensations too, like headaches and nausea.
The mind and body all kind of ties together and lets us know something's not right.
Exactly.
So how can we encourage those that are struggling to reach out and get professional help?
Yeah. I think the more we normalize these conversations, the more people will realize it's okay to share their pain. So like I said, with the FaceTime piece, maybe just calling somebody up and saying, I'm going to call you every morning, even if we don't talk, just to let you know I was thinking of you. Because a lot of the time people want you to do that, but they're so afraid of, I hear my clients say, I don't want to burden people. I don't want to burden.
Yep.
So they don't ask for help. But really, if you just called once a day without them asking, a lot of people would love that. Now, if they've told you, hey, I grieve better with, like, I know how I grieve and I don't want you to bug me. Okay, don't keep bugging them. But if they don't tell you what they need, show up for them and let them know that you can help them with finding help, whether you go on psychologytoday.com with them and help them look for a therapist, or just keep reminding them that you have their back.
I think that's so interesting, because we kind of live in this world where we're connected all the time, and yet we don't actually pick up the phone and call people.
Right.
Like there's so often times I'll get messages that say, hey, can I call you real quick?
Yeah.
And like we've just gotten away from just picking up the phone and calling people, when really we need to do that more.
Exactly. Exactly. And I think so you're talking kind of about like media, everyone's everywhere, right? But then someone experiences loss, and oftentimes it's like crickets. People don't know what to say, so they don't say anything. And that's kind of like the worst thing that you can do.
So how do we know when we're done grieving?
Great question. I had seen a quote earlier this week about how we never really move on, but we do move forward. And I think that really describes it well, because depending on the type of loss, like if we lose a job and we then find our new dream job, we might completely move on and never care about the other job before again.
Right.
But if we lose like a human or a pet or a relationship, parts of that might stick with us forever. And so we're kind of adapting to a new normal. And so the last stage of the grief stages is the acceptance stage. And in acceptance, it doesn't mean we've just like left it all in the past. It means that we've kind of come to terms with what we want our new normal to look like. And we have ways to kind of remember the good parts of what we lost, but we also are moving forward, if that makes sense.
Yes. So are there some resources that we can use to help us deal with loss?
Definitely. And I have a bunch. So I will give you at least 5 good ones. The first, and I'll link them on my Instagram too. So
perfect.
Yes, at dr.Kelsea Visalli is my Instagram, and I'll put all these resources there too. But there is a Center for Complicated Grief, if you just type that into Google. And there's articles all about kind of what is grief, how does it manifest in the body. So once again, the Center for Complicated Grief. And then there's some really helpful YouTube videos to help you understand if you have a family member or friend who's grieving and you don't know what to do. Go on YouTube and type in how grief affects the brain and what to do about it. The NBC News, they have a really helpful kind of explanation of how the chemicals in our brain are affected. And then the best one that I've seen yet is from Megan Devine, How Do You Help a Grieving Friend? And it has a cute little kind of animated thing of like, it's basically all about let them feel their pain, but be with them. And then 2 book suggestions. One's from Megan Devine. It's Okay That You're Not Okay. And then the other book is Healing After Loss by Martha Hickman.
That's great. Thank you so much, Dr. Kelsea Visalli, for taking time out of your day to give us this great information. And we'll get this up at radionowindeed.com. We've also talked about mental health in general and intuitive eating. We talked about that last week. You can find the link to those Instagram lives at radionowindeed.com. And remember, you can listen to us live at radionowindeed.com, download the Radio Now app, or just tell Alexa to open Radio Now 100.9.